Hey, everybody, welcome to Monday Motivation. This is how to pass Nclex as well, which is a huge part of just staying motivated, is getting the education that you need to get your nursing license, which is the goal. So come on in, let me know where you're from in the comments. This is also an amazing opportunity if this is your first time to follow the Facebook page and subscribe to the YouTube channel. Let's do that together because we are a community. We are always studying. This is where it happens. We're going to talk about critical thinking today. Critical thinking today. Are you down for this study session? It's going to be a quick, intensive one. So let's just get into it. We're going to look at questions. We are going to look at questions. Good afternoon. It's Monday. It's Monday. All right. So our first question is this. Ready, Mary? I'm so glad you're ready. At a senior citizens meeting, a nurse talks with a client who has diabetes mellitus type 1. Okay. Which statement by the client during conversation is the most predictive of a potential for impaired skin integrity? Here are the options. Number 1, I give my insulin in my thighs. 2, sometimes when I put my shoes on, I don't know where my toes are. 3, here are my up and down glucose readings that I wrote on my calendar. Or 4, if I bathe more than once a week, my skin feels too dry. So here, guys, we are breaking down a scenario. We're breaking down a question stem, and we are looking for risks. All right. We are evaluating our client's risks by analyzing cues that they say. So I give my insulin in my thighs. Sometimes when I put my shoes on, I don't know where my toes are. 3, here are my up and down glucose readings that I wrote on my calendar. Or if I bathe more than once a week, my skin feels dry. Oh my goodness. I see a lot of choices between 2 and 4. And because we are looking for a potential for impaired skin integrity, those two make sense that you guys are choosing. But there is one which is better than the other one. Okay. We're looking for the most predictive. And so that's going to be number 2. That's going to be 2. Sometimes when I put my shoes on, I don't know where my toes are. So very good if you were able to discriminate between those two. Hey, also, I want to tell you guys that right now we are in the middle of our 30-day challenge where we do just this, where we look at the content from the virtual trainer and the Quick Facts book. We're doing a 30-day challenge with these books. So if you have these books, you need to tap in by going to remarnurse.com/30 days. If you don't have these books, and you want to see what it's like to study the content, to focus the content, tap in as well. So the reason why two is better than 4 is because 2 was talking about the client not knowing or having a lack of sensation in part of their body, right? 4 is just talking about the skin being dry. So we are more concerned about the clients not feeling pain or pressure because these are the type of patients who have a higher risk for impaired skin integrity. Okay. Shout out to Nurse DeWitt, who says, "Hi, I passed my Nclex PN on the 2nd of this month." Wow, literally just days ago. Thanks to you and the ReMar family. That is you guys. So amazing. You are our Monday motivation. I love to see it. Okay, we are jumping back in. We're diving back into the content because this is where we need to be in order to do well on this big test that we have coming up called the Nclex. Question 2 says this: the nurse is preparing a client for a cholecystectomy. In classifying the type of surgery according to the purpose, a cholecystectomy belongs to, number 1, is it a diagnostic surgery? 2, a palliative surgery, or palliative, depends on who you ask. 3, a constructive surgery. Or 4, an ablative surgery. Do you know? Do you know? Do you know? Do you know? Basic terms. This is the fundamentals of nursing, getting past the hard words. The correct answer. Let me see what you got on the screen. Good morning. Yes, we are past the good mornings and we are into the content, guys. So if you're just joining us, we have a very serious question presented to us. The cholecystectomy, what type of surgery is this? Is it diagnostic surgery, palliative surgery, constructive surgery, or ablative surgery? Okay. I love that I see here a lot of people just giving it a go. And some people are like, hey, I don't really know, but I'm going to try. The correct answer is ablative surgery, in the idea that it is going to remove a part of the body, and a not so good part of the body, a diseased part of the body. So let me just go back for 1 second to look at the other definitions. Did you get this one right? So the diagnostic surgery, we are expecting that procedure to be something like a biopsy, right? Where we are trying to determine what the cause of a situation is. Palliative surgery, palliative surgery, this is to reduce the symptoms of something. So we are doing it so the client can feel better. And I guess that you may think, well, if the client has a cholecystectomy, they may end up feeling better, but that's not the initial idea of this surgery. Constructive surgery, we know with like plastic surgery or clients who are going through gender reassignment, you're actually forming a new presentation. That's a constructive surgery. So a cholecystectomy wouldn't apply to that, but ablative it would, because you're taking away a part of the body that is not functioning properly, that is diseased, that is causing the patient to have a worse condition. Okay, does that make sense? All right, let's move on. Let's move on. Question number 3 is this: a client who was recently diagnosed with heart failure, heart failure, is taking spironolactone. All right, spironolactone. The nurse knows that this medication is beneficial for clients with heart failure because, number one, it allows the mechanism of aldosterone to take place. 2, it promotes potassium excretion. 3, it decreases blood glucose levels. Or 4, it inhibits cardiac hypertrophy. There is a lot to the content value that is placed in this question. This question, you guys, I'm going to read it again, and I want you to look for what the question is asking you, because I'm seeing the answers come up on the screen and the answers are not reflective of what you're being asked. It is reflective of you trying to show what you know. There's a difference. There's a difference. A client who was recently diagnosed with heart failure is taking spironolactone. The nurse knows that the medication is beneficial for clients with heart failure because number 1, 2, 3, or 4. This is very important. This is why I say all the time, when you take Nclex, make sure you're taking the test that they give you and not the test in your mind. Okay, there's a difference. Correct answer. I see you guys changing. I see you guys you're turning this thing around based off of my prompting. Okay, and that's okay that you're doing it while you're studying, but you have to be willing to do it. You have to be capable of doing it on your exam. So the correct answer is indeed number 4. Okay, the reason why it's number 4 is because we are talking about a client who has heart failure. And so we know the issue with heart failure. Your body is retaining fluid. Your body is retaining fluid in terms of the fact that it is not getting it from the, it's not getting the excretion from the kidneys, right? And so what the spironolactone does is it helps this congestive heart failure patient, by preventing the enlargement of the heart, right? It don't have nothing to do with the potassium. The potassium sparing part, it's okay, all right? I mean, it's cool, but this person has an issue with their heart, the fluid retention. That is the benefit of taking spironolactone. And so, yes, it's cool to know some points about a medication, but it's cooler to know how it is keeping your patient alive. That's the cool part of it. So, do you guys get that? All right. Okay. Shout out to the nurses who are passing. Let's go. Let's get into it. Again, I have another question. Question number 4. The nurse is administering digoxin. One of the nursing considerations is to monitor the following electrolyte. Okay. The nurse is administering digoxin. One of the nursing considerations is to monitor the following electrolyte. Is it 1, potassium, 2, sodium, 3, zinc, or 4, copper? What do you guys think? I see the answers rolling in. Shout out to over 200 nurses right now who are studying with me on this Monday. You guys know how we do it every Monday. Show up, give it your all, and then keep it moving. We want to win this day. And the way we can win this day is by small things, small decisions. That's what I've been talking about with Mark. Small decisions really affect a lot of other bigger things. So the correct answer for here, you guys are doing fantastic. The correct answer is going to be number 1. You got that. Yes, when you're taking digoxin, you have to monitor your potassium levels. This is like nursing 101. This is like fundamentals 101. This is how you pass NCLEX. And a lot of you guys are saying, yes, now is my time to pass. I want to win. I want to get my license before the summer is over, before my kids go back to school. Some of you are testing very, very soon. And knowing information like the relationship between digoxin and potassium is crucial. Low levels of potassium can lead to arrhythmias in general, but especially when a person is taking digoxin, it can increase digoxin toxicity. All right, digoxin toxicity. So we're not worried about the sodium levels being low, because digoxin can actually increase the intracellular sodium levels, and we don't have to worry about digoxin interacting with zinc or copper at all. So if you have your quick facts for Nclex, the 5-star edition, in the back of this book, you guys know it is the top pharmacology section, which is the top 100 drugs for your Nclex. Okay, this is the pharm section in the back of the quick facts. During our 30-day challenge, we are going over quick facts and we're going over the virtual trainer workbook. So hop into the 30-day challenge. We're just at the beginning of it. And every day, you guys know I go live on Mondays, but if you go to remarnurse.com/30, every day you will be getting a video of me going over this information from the virtual trainer. So tap into that. All right, we're going to get back into it. And so we are talking about here the fundamentals. And so here's another one. All right. A client is ordered for a paracentesis due to ascites. You got to know what those terms are. Paracentesis due to ascites. What instructions should the client be given just before undergoing paracentesis? Okay, so this is content-based. Number 1, NPO 12 hours before the procedure. 2, empty bladder before the procedure. 3, strict bed rest following procedure. Or 4, empty bowel before procedure. All right, what do you guys say? I see the answers rolling in. And you know what, guys? You know what? You're doing really well today. Like if you showed up and was like, I'm going to give it 110%, you're doing that because I see the work that's being done on today. And it's so great to be able to start the week off in this way. So the correct answer, is definitely going to be empty bladder before procedure. I didn't even have to wait. You guys knew that. All right. Because paracentesis for maybe my new nurses who are working, I'm sorry, for my new nurses who are working in nursing school right now, you may not have come across this specific diagnostic procedure. But what we're doing is if we do a paracentesis on a patient, it is because they have accumulated large amounts of fluid in their abdominal region, their peritoneal cavity. This can be related to the heart failure that we were just talking about. But, anyways, so because we're using a needle that is going to go through the umbilicus, the client needs to void or use the bathroom before the procedure so that they don't accidentally get their bladder stuck, okay? Because a distended bladder can move a lot of things, right? Remember, if we talk about pregnant women, we tell them to void before we do a fundus assessment, because if your bladder is full of urine, it can displace your uterus as well, too. So emptying bladders before these type of procedures are very, very important. All right. So did you get this? Did you get this section of questions correct? If you did, if you got 4 out of 5, there was like one that I could give that you may have missed, but you should have at least gotten 4 out of 5 of these questions right. If not, that's okay. Just dive back into this content. I'm not going to keep you guys long. My Monday motivation, I had one prepared, but this is the thought that's on my heart right now. And it is just simply this: you cannot learn what you think you already know. And this is a very powerful statement because when we are talking about studying for Nclex, when we're talking about joining my 30-day challenge, this all takes place after you have been through a formal education in nursing school. After I'm telling you guys, come study with me. Come, I'm telling you guys, get in the virtual trainer. You need to learn. But a lot of mentality that I come across with nursing students is that I already know what she's talking about. I already know this stuff. I know when she says content, I learned that in nursing school. And what I'm telling you guys is that there is a higher level of knowledge that is required for your board exams that you may not have had to prove that you know before this time. So what we learn in nursing school, what you're introduced in nursing school is great, but I am realizing the longer I stay in this space that there is a gap of knowledge between nursing school and state board exams. However, if you have the mentality that I know everything and I don't need to learn, you will not be able to learn. You absolutely won't. It is impossible to learn what you think you already know. So what I'm saying is that with this opportunity that I give you guys every Monday, take advantage of it. Okay. With this opportunity of the 30-day challenge, usually I only do this once a year. I'm doing it right now because there is one student who will take advantage of it, and that student will be successful and get their nursing license. So if that is you, join the 30-day challenge, remarnurse.com/30. Come in with a desire and an expectation to learn something new. Come in with a desire to improve your critical thinking, with a desire to test your recall knowledge faster, right? I like this. Tarika says, I appreciate your reviews. I know I don't know it all. All right. And so that is the approach you have to take in studying for your board exams, in nursing in general, and in life. All right. You have to be open. You have to be open to being a student one more day. And so I'm asking you to be a student one more day. All right. One more day. Have that mentality. I'm learning today. I don't know everything. So that is what I'm challenging you guys to do. I'm going to leave you with that. Jump into the 30-day challenge. Join me there. remarnurse.com /30 days. Okay. Be teachable, Mary. Be coachable. Always are It'll jump off.
Hello everyone, my name is Tiffany and I am a ReMar nurse. I took my Nclex on June 15th and I passed on the first try. I ordered the VT and took it in 3 weeks. I did the course in 3 weeks because I had already had my date set, and you know, this book and the quick facts, this stuff is the truth, y'all. I had a baby the last 4 months of nursing school, and I was a little worried when I returned back to school from maternity leave because I was like feeling like I couldn't remember many things. And you know, I would just say that while taking my test, I just was thanking God that I did the VT, because there were things that I probably would not have remembered or been able to really critically think about had I not taken the course. So, you know, for those out there who need some extra encouragement, just take it from me. Like, this is everything, and I'm so grateful. And my favorite part about this is that the ReMar team is faith-based. That means a lot to me, and it helped to reinforce and keep me encouraged with, you know, just the thought of, you know, with God, everything is possible. And that is so true. That is so true. So just continue to stay focused out there, y'all. Get the VT. Get the VT. You owe it to yourself. You owe it to yourself to do it. So